Hello guys, welcome to this session on NEET PG Reality Check, how to prepare if you don't qualify. I hope you guys are able to see me and hear me well. My name is Dr. Jhanvii. I am the Anesthesia educator on Unacademy, and if you guys are able to see me and hear me well, please leave a thumbs up in the chat box and we can continue with the session. Alright, yes, I can see that the streaming is absolutely okay. Now, I know a lot of you have already not liked the topic that I am taking right now. A lot of you are like, हमें negative नहीं सोचना है. We don't want to think that we will not qualify for NEET PG exam. Ma'am, why are you asking us to listen to this video? But I believe that in life you should be extremely practical. You should know that if there is a winner, there also has to be someone who fails. And every time you cannot be a winner. Sometimes there is also failure that has to be met with, dealt with and accepted. And if you prepare yourself for failure, then in fact you can have your strategy in place so that your mind, your mental preparation is perfect at that point in time, and you know how to deal with it, and eventually you will know what to do with it if you face such a situation. Okay, so here I am taking a session for you guys on how to prepare if you don't qualify for the NEET PG exam. Now many of y'all must have already calculated your marks, the questions are all out, the answers are all out. So a lot of you keep messaging me, ma'am, I've got so much, I've got 120 right, 130 right, 150 right, will I get a seat? Now the question is not on how many marks you've got, the question is on what is the comparative ranking. So this year's paper was relatively easy, and as a result of it, it makes it even more difficult to get a good rank in this paper. If it is a tough paper, most of the people who have studied well and who have not made silly mistakes will easily clear it and get a rank. Okay, but when it is a easy paper, remember that your one silly mistake could cost you a rank of thousands. Now I'm not trying to scare you out over here, but that is the reality of whenever they set an easy paper. It's just that if you have made a marking error, or if you did not understand the question correctly and you mark the answer wrong, automatically there will be 1,000 other people who would have gotten that question correct, and they would move up in ranks as compared to you. And 1,000 ranks means 1,000 seats, correct? Now it may not be in the branch of your choice or in the city of your choice, but those are how all the seats get filled up, and then we end up at a place where we don't know what to do because you have not qualified for the exam, or rather you have not got a seat of your choice that year. So should you go ahead with it, or what should you do in that case? Should you wait back? Should you repeat? What should you do exactly? All those questions will be answered today. Hello Subrashmita. Hello everyone. So welcome to Unacademy. The Plus subscription on Unacademy will give you access to both live and recorded classes. You can learn from India's top educators. You can compete in live tests and quizzes. You can access our question bank with 25,000 plus questions. And we also have printed notes for those who buy the 12-month and above subscription. The iconic subscription gives a partnership of Unacademy and Prep Ladder. So you get all the live lectures of Unacademy along with the video lectures of Prep Ladder. And these are some of our special class features. As you can see, you have interactive live classes, we have polls for the learners, we have raise a hand option, and also at the end of the class you will get a PDF to download of the classes. We have a highly effective question bank. In fact, all the questions of NEET PG were present in our question bank, which has over 25,000 questions. And these are the batches that we have right now. If you would like to join the Focus FMG batch for the FMG learners 2021 and the Target Next 2022 batch. And we have a few offers going on right now. So if you buy the 2-year subscription, you get 4 months free. If you buy the 1-year subscription, you get 2 months free. And if you guys would like to buy the Unacademy subscription, don't forget to use my code Dr.Jhanvi Life. This code will help you get an extra 10% off on your Plus subscription. Alright. So now let's begin with our session for today. So as I told you in the beginning of the session, the paper was easy. You can expect that at every marks, okay, so like at 150, at 151, you will be having nearly 1000 to 1200 people who will be getting that much score. So if your mark is one up or one down as compared to your peer, the ranks are going to change a lot. So now what will be the expected cutoff ranks? Okay, so we have three types of colleges. We have our government medical colleges, where you will be getting your MD MS seats. Then you will be having the private medical colleges or the corporate hospitals, where you will be having our DNB seats, correct? And of course then you will be having the diplomas. Now if we talk about the government medical colleges, clinical branches. In clinical branches, to get a clinical branch, you should be getting a rank anywhere between 1 to say 18,000. In non-clinical branches, your rank can go up to anywhere between 35 to 45,000. This is for a MD MS seat, okay? So this is for your government medical colleges. When we are talking about DNB, again the number of ranks that you go through will increase in DNB. So if you are looking for a clinical seat, you should be getting a rank in less than 30,000, and in a non-clinical seat you should be getting a rank in less than 60,000, okay? And for your diplomas, you should be getting a rank less than 80,000 in order to get into diplomas. Now all this is a projection. This is based over the last few years ranking system, and just so you know, now it depends on what you are trying to get into. If you are trying to get into MD anatomy and you feel that you are going to get within the first 50,000 ranks, you have a good option of getting into an MD anatomy seat in a government medical college, okay? So this is the first thing about clinical and non-clinical branches. The second thing will be about the place where you will be studying. So obviously if you are talking about the major cities, you should be getting, if you want to get into Mumbai, Delhi, Bangalore, Chandigarh, all these major cities, you should be getting a rank within less than, for clinical seat, I would say less than 15,000, and for non-clinical seat you should be getting a rank in less than 25,000, okay? Now other than this, if you are okay with joining a peripheral center, then in that case your ranking will go up accordingly. Now many of you all must be thinking that are these the real cutoffs or is this going to change? Of course it is going to change. Last year's exam was much tougher as compared to this year's exam. This year's exam was much easier, so there will be change in the rankings, there will be change in the cutoffs, and there will also be a change in the number of seats that have been added, okay? So this is our expected cutoff rank if you think that you will get a seat or not. Next is our government versus private medical college. Now this is for those of you who are getting a seat, okay, and are not sure whether they should join a government or a private medical college. So I am going to give you a few pointers of why would you choose any of the above. So if you are confused, many of you all will say that, ma'am, my exam was okay-ish, but I don't want to study for another year again, I don't want to repeat again, so I don't know what should I do. Should I take up a seat or should I not take up a seat? So if you ask me, weigh your pros and cons. That's why I'm giving you the pros and cons of every type of thing, of the subject, of the type of college, of the city. All of that has to be taken into account. Sometimes we don't know what is good for us, and we end up rejecting all the seats and sitting for another year and getting a lower rank than before. So that could be more disheartening. I have seen this personally in many cases, that people get disheartened in the second year of preparation, third year of preparation, and then their rank actually ends up getting lowered. So as a result of this, you should have to be very in your heart. You should sit, you should take down a couple of points in a book, write it down. Are you actually prepared for repeating another year? Do you really want to wait for that according to what you've thought dream branch, or is that dream branch just on the basis of a whim? So let me give you an example of that. So many of you all, when we ask you all what is your dream branch, many of you all will say, ma'am, we want to join radiology, ma'am, we want to join derma, ma'am, we want to join surgery. Now when you say all these things, there are two things to be kept in mind. Have you actually done postings in these branches and seen whether you can live a life like that or not? There will be many toppers who take up radiology thinking that's one of the premium subjects, and then they realize that no, I am not having any kind of clinical interaction with the patients, and this is not what I wanted to become as a doctor. And then they end up leaving that seat, repeating the exam again, and then taking up a more clinical branch like medicine or surgery. Okay, then many students who are physically not up to the mark, or who get tired easily, or who have comorbidities, will end up taking branches like surgery or orthopedics. In the long run, they realize that these branches are something which require a lot of physical strength, and along with that also a lot of mental strength. You don't eat for hours, you have to work in the ward day and night, and it is extremely stressful branch. So they take it up only on the basis of the fact that they've attended a couple of OTs during their MBBS days, and they believe that, oh, it's so great to be a surgeon, or it's so great to be an orthopedic surgeon. Everyone comes and talks to you with so much respect, you make so much money, and their life is so rosy as a surgeon, but they don't realize the kind of work that goes behind it. So many of you all, only on the basis of a couple of OTs, you will decide that you want to do ortho or surgery, and then when it comes to your PG preparation, your NEET PG rank, and picking up a seat, you realize, oh my god, I'm not getting this seat of my choice, I will have to repeat the NEET PG exam. But by default, if you take up a lighter branch, now in lighter branch I'm saying something which is not so taxing, something with fixed hours, even if you are talking about microbiology, even if you are talking about pharmacology or anesthesiology, all these branches have fixed number of hours, and you can actually not put your physical strength into so much stress. You are not going to be mentally stressed out for the rest of your life, and you may realize that it was actually a blessing in disguise that you ended up going into a less stressful branch as compared to doing something more stressful. Okay, so this is what I always tell people: you should always take the result positively with a pinch of salt. Okay, so that is our first important thing for today. First of all, sit down with yourself. You have enough time now to realize whether you want the branch that you are running behind or not. Okay, now very good way of identifying this, and in fact I did the same myself when I gave the NEET PG exam. Once I finished off the NEET PG exam, I knew that approximately what will be my rank. So accordingly I started weighing my options. Now anesthesia posting I had, as per se as most of you all must have also done, I had not really attended much of it. So what I did was I joined in my MBBS college for around 15 days. Now I'm not saying go and spend your entire day over there. No, this is your chance for actually enjoying your life, for traveling and everything. So just go for 10 days, maybe for 2-3 hours each, and try to get to know the branch, try to see what is the kind of work that is done. I realized some pros of anesthesia, that the timings are fixed. Once I finish off my duty from 8 to 4 p.m. and I shift the patient, then no one is going to call me after that unless I am on emergency calls. So on non-emergency days I am going to be completely free, and I will not have any stress of looking after patients after I leave the hospital. I also realized some cons, that anesthesia is a type of branch in which the patients and their relatives actually don't know much about the anesthesiologist. You all are like the hero behind the curtains. They don't speak much to the anesthetist during the surgery, after the patient is discharged. The entire interaction is with the surgeon only. So they don't sometimes, in fact in India, if you ask someone, do you know what is an anesthesiologist, they will even have a question mark कि ये doctor भी है या नहीं. Okay. So that ignorance and that being behind the curtain is one of the things that you will face as an anesthesiologist. Okay. So you see, you weigh the pros and cons based on what kind of branch do you think you're going to get. So you have the time now. Go for 10 days. If you want, you can go for 2 hours to different OTs. Maybe you can go and do OBGY one day, or don't go for just one day because you may not realize in one day, but at least 3-4 days of OBGY, 3-4 days of anesthesia, if you feel that you have not had much exposure to that branch during your residency. The other thing you should be doing is speaking to the people who are in that branch. Okay. Now, as you all know, my husband was in general surgery at that time when I had just given NEET PG exam. So it was a good eye-opener for me looking at him go to work so early in the morning, come back so late in the night, and also the struggles of a general surgeon after MS. It's like something which has just started. Okay, your general, once you finish your MS, you will still be out there. You can't just go and start working immediately. You have to train even more. The next question will be MCH करना है या नहीं. The next question will be fellowship करना है या नहीं. Do you want to do a fellowship in India or do you want to do a fellowship abroad? And even after doing MCH, super speciality or fellowships or multiple SR-ships in different hospitals, you have another 5 to 6 years at least of practice before someone comes to know of you as a general surgeon and you start working full-fledged with a lot of patients. Okay, so literally you, as a surgeon, I saw that he was going to settle at the age of 40, not any time before that. And especially being in a big city like Mumbai, it becomes even more difficult because of the competition. So when we don't realize all this when we are doing MBBS, but this is the time that you have to go and speak to people who are already in that branch. So speak to, if you are suppose for example interested in ENT is one of the upcoming branches. Go and speak to the residents over there. Okay, so let me write it over here for you guys. What all should you be asking the residents? So if you are speaking to, you are interested in ENT, first of all ask them what is the cutoff rank. Okay, ask them about the good hospitals that are there in your area or in the city of your choice. Then ask them how is the residency period like. Okay, you have to also take this into account that you need to join 3 years of extremely stressful residency before getting the degree. So if you are not able to deal with the stress, you may have to leave the residency just like that, or you may fall sick during the residency. So you don't want to be in that situation. After residency, ask them about the options in super speciality and also in fellowship. Then ask them about the job options. How easy is it to settle? Okay, so there are many branches like ophthal, radiology, in which if you want to open your own center, you may end up requiring a lot of equipment which will cost a lot of money. So your other option should be joining hospitals, but nowadays many of the branches are saturated. Okay, so at that time when everyone was interested in taking up radiology, there were radiologists joining left, right and center with DMRD degrees, with MD degrees, DNB degrees, everything. So now most of the centers are getting saturated, and as a result of this, finding a job, if you are not going to open your own setup, then finding a job in these branches may become difficult. Okay, so ask the resident who is there in the branch of your choice about all of these things. Now this resident should be someone who is not frustrated with the branch. Okay, so ask someone neutral who is in the second year of the residency and ask them about all these things. How do they feel exactly taking up that choice of residency, and then see if you can put yourself in the shoes of that person and also join. Okay, so a few of you are messaging now. So S Singh is saying that he wants medicine surely. So if you are sure what you want, then you should be waiting for the results and looking at the ranking. Okay, so we'll come to that. If you are getting in, what to do. If you are not getting in, what to do. Next, Pre-Vash is saying that I want anesthesiology and I want to shift to the UK. That's very good. If you feel that you're going to get into, you've attained enough marks to get into a good anesthesiology college, then that's extremely good. And you also have charted your plan ahead. That is extremely important, because even when you join residency, you should be knowing what you will be doing after residency. But I'm not saying कि 5-year plan या 10-year plan ready होना चाहिए, but थोड़ा idea होना चाहिए. If you're planning to join somewhere abroad or shift abroad, then in that case you should start preparing for it from the first year of your residency itself, so that you don't waste too much time. Alright? Now, for a few of you who were asking me, ma'am, should we join a government medical college or should we join a private medical college? What if I'm getting a seat of ENT in a private medical college but not in a government medical college? Should I go ahead with it or no? Alright, so this is for you guys. So in a government medical college, you will mostly get MD, MS or diploma degrees, and in a private medical college, you will mostly get a DNB degree. Okay, so what is the pros and cons? Now when you are looking at government medical college, you will be having more cases. Here you will be having lesser number of cases. Now this does not hold true for every private medical college that you want to go to. There are many colleges like Gangaram in Delhi. There are many colleges like Max in Delhi or Hinduja in Mumbai, which actually have a lot of patients. Okay, so if you are going to one of the apex hospitals in the city, yes, you will have enough number of cases. But if you are going to a corporate hospitals which is very expensive and only a particular section of the society comes to those hospitals, the number of cases and practice that you will get is less. Now how should you take that into account? If you are planning to take surgical branches in these private medical colleges, remember the patients are they pay a lot for the surgeries. So as a result of this, the consultant will always want to make sure that he is the one who's operating primarily on the patient. So if you're taking a surgical branch in one of the private medical colleges, maybe the amount of skill training that you get or cutting that you get will be less, so as compared to a government medical college. So make sure that you find out before filling in any private medical college for your preference list. Make sure to find out from someone who's already there whether you are going to be getting enough of skill training or not individually in those 3 years. Okay, now if you feel कि skill training तो इधर हो नहीं रहा है, you call up and you ask someone and he says no, don't come to this hospital, यहाँ पे तो skills ज़्यादा train नहीं करते. But on the other hand, academics is good. They won't give you individual cutting, but academics में they are very good. They teach you every time and they are interested in publications and everything. What do you do in that case? So in that case, remember, even if you're getting a seat right now and you're really interested in joining the hospital and all your stars are aligning, you can always train for your skills in your SRship, that is in your senior residency. Okay, so if you feel you've not got enough cutting during your junior residency, in your 3 years of junior residency, you can immediately after getting your MD, MS or DNB degree, join a high volume center where you can आराम से go and do some kind of senior residency where you can train in your skills, you can carry out surgeries on your own, you can manage OPDs on your own. Okay, but for medical branches, in most of the cases, private medical colleges will also have very good number of cases as compared to government medical colleges. Okay, so if you're planning to take a surgical branch, ask about that medical college, ask about that private medical college and then join it. If you're planning to take a medical branch, number of cases are almost equal everywhere, you will get a good exposure. Okay, so this is one of the things. Second important thing is the money. So government medical college obviously will be having lesser fees as compared to private medical colleges. So if you are affordable for the fees, don't stress yourself out by taking a large loan and then you will have to pay that loan off later. But remember, if you're affordable even a little bit to take up that seat in a private medical college, it's better to do that than wait for another year and again have a query in your mind, are you going to get into your seat of your choice or no? Okay. Alright, so this is the first thing about government versus private medical colleges. And for those of you who have come late, what I was saying is definitely use this time to try to find out, are you really interested in the branch that you're thinking about? So do you really want to do orthopedics, and how is the orthopedics option aage jaake? So go and ask some resident about the cutoff rank for it. Ask how is residency, what are the job options, what are the post residency study options, academic options like super specialty, fellowships, abroad options, and is the market saturated with that branch or no? Okay. Alright, now next, should you take any seat or should you wait for your dream seat? This is the one question that everyone keeps asking all the time. Now, how do I evaluate this question? Okay, now dream seat, when you say dream seat, for example, if I tell you that my dream seat is OBGY, but I have attended only 5 emergencies, and that too I used to leave for home at 12 a.m. So during the emergencies also I used to be like, no, I have studied the whole day and then done emergency, now it's midnight, now I should go and sleep or I'm going home. Okay, so is this, and after the 5 emergencies I have seen some 10 LSCS and I have seen some 20 deliveries, and I have decided that yes, this is what I want to do, OBGY is what I want to do in life. So is this actually my dream seat or not? Okay, so remember, if you have this kind of exposure to your dream seat, then this is the wrong exposure. Okay, how do you actually qualify a dream seat? First of all, very important thing, you should be attending the OPDs and seeing what kind of patients come in. Does the pathology actually entice you? Does it interest you? Do the kind of patients that you're seeing, different kind of patients, different kind of diseases, do they actually make you think and want to do that for the rest of your life? And second thing is, you should see the elective OTs. So in elective OTs, you should have seen all the different kind of cases that come. You should be seeing your gynecology OT as well as obstetric elective OT, not just one OT. एक दिन चले गए OT में और decide कर लिया कि OBGY करना है, बस इतने से काम नहीं चलता है. Okay. So third thing is, you should be attending full emergency call. Now why do I stress on this point? This is one of the most important things when you take up residency. Many of you all don't know how taxing an emergency call is as a resident, and you know, it's very funny to see the first day that someone arrives into the OBGY branch, and all the OBGY JR2 and JR3, that is junior resident 2 and 3, will be waiting कि JR1 कभी आएगा, and we'll put them on 24-hour call duty. And the day that the 24-hour call duty comes, the JR1 realizes every time, why did I take up this branch? Okay, so your typical emergency duty will start at around 7 a.m. in the morning. You will be attending your elective OT, then that will finish by about 3 p.m. when you will start your emergency OT, and that will finish the next morning at 8 a.m. and you will probably not get time to sleep, to eat, to even go to the bathroom at this time. Okay, so are you ready to do this kind of an emergency? Versus if you take up a branch like, say, dermatology. Okay, so you didn't realize that OBGY would be so taxing, but you were also getting a dermat seat. Now you go and see your friend who is a dermatologist, and he is doing residency, and he says, today I am on call. So when you ask him, what do you do on call? He says, nothing, I just have to work in the ward from 8 a.m. to 8 p.m. So I'm working in the ward from 8 a.m. to 8 p.m. on an emergency day, and then 8 p.m. to 8 a.m. that is at night I sleep. If there is some patient who comes to their emergency with some kind of dermat reaction, then in that case I have to wake up and go and see the patient. Okay, so this is the kind of emergency that someone in a branch of dermatology would have. Now that will get you thinking, why did I think that OBGY was my dream seat, and why did I take up OBGY? Why did I not find out all this before filling my preference form, and why am I thinking about all this right now? Okay, so remember, many of y'all, I see y'all repeating year after year thinking that this is my dream seat, I want to get only into radiology, and I'll keep giving the exam till I get a radiology seat. After 2, 3, 4 attempts, you may even get a radiology seat. When you start working, you realize, what did I actually want the radiology seat for? I'm not talking to patients, I'm not having a direct contact with the patients, and I'm not even having any kind of clinical exposure that I always wanted in life. Or I am someone who used to like surgery so much, I used to like cutting so much, but I got a great rank and all my seniors told me, rank acha aaya, to radiology le lo, but I'm not enjoying it. Okay, remember, whatever seat you take, you need to do that for the rest of your life. That is a very important, it's a very simple but a very important statement. If you realize that in your head, are you ready to do that branch for the rest of your life? And in fact, around 10 to 12 hours every day of your life you will be spending doing that branch. Are you ready for it? Is it the right thing for you? So first things first, re-evaluate your dream seat. Okay, so half of the people will end up taking another branch. If you re-evaluate your dream seat, you will end up taking your another choice that you had not even considered before. Whenever you think that you're not going to qualify for the exam, or you're not going to get a rank good enough to get your dream seat, first ask yourself this question: is it actually your dream seat or not? Okay, alright. Next is, should you compromise on your choice of college? So if you are going to be, suppose for example, now as Privash is saying that she wants to get into anesthesiology. Okay, so Privash is saying that I want to get into anesthesiology. I have decided, definitely it's my dream seat. I have asked many people and I have decided that this is the branch of my choice. Okay, so should I take this up or not? Now what happens in this case? Now Privash, for example, is getting a rank where she is not getting MD anesthesiology in a government medical college, but she is getting DNB anesthesiology in a corporate hospital. Or for example, she is getting diploma in anesthesia in a good hospital, busy hospital, government medical college only. Okay, so now again there will be a question over here. So should I repeat and try to get into MD anesthesiology? Have I not qualified? Have I not done well enough in this exam? Should I try to repeat and give the exam? Or should I take up the DNB or DA degree? So another question for you guys. Alright, so this question is not that difficult to answer. You remember, for what I have seen, now I am almost 6 years down the line, and what I have seen, looking at it in hindsight, so I am able to suggest to you guys. Suppose you join a college in a DNB or a DA degree where there is not much work. Okay, so here you don't have super specialty OTs, but you will learn basics of general anesthesia, regional anesthesia, and there is decent academics in this place. Okay, and you're desperate to get into anesthesiology. So what would I do, thinking into hindsight? Should I wait for another year, give the NEET PG exam again, still have that question mark on my head ki seat milega ya nahi, or should I just take up the branch? Now remember, life is very finite. No one is going to wait for you for a long period of time. So anything can happen in life. If I was in your place, I would take up the seat. Now you all will say, ma'am, you're only saying that there will be less work, there will be less academics. But remember, at the end of the day, you can always make up for the loss. And how do you do that? So let me give you one example. If I have joined a diploma in anesthesia and the college that I have joined does not have much work, so 2 years के लिए I will do my residency and utilize that time that I am getting, since it's not a very heavy college, in studying for my post-diploma CET exam. In my post-diploma CET exam, as a result of this, I will try to get a good rank and get into one of the busiest medical colleges that is present, so that I have another chance at increasing my skills. Okay. On the other hand, suppose you take up DNB. For 3 years you take up DNB. Now let me give you an example. There are DNB hospitals which are solely focused on one subject. So suppose you join an orthopedic hospital, they will do only regional anesthesia. You will not have much of general anesthesia, pain, critical care exposure. Okay. So what do I do in that case? Am I doing something wrong by joining such a restricted hospitals? So answer is no. Do your best in those 3 years to learn what that hospital is good at. After that, join a medical college as an SR. Okay. So join any government medical college in your city as an SR in that case. And when you join a government medical college as an SR, it's not very difficult to get, because SRship is available in abundance. You can easily for 1 year rotate in different super specialities and learn everything that you wanted to in that 1 year. Okay? So you've got your degree, you've not wasted that 1 year of giving the NEET PG exam again and the stress that comes with it. And what you have done is try to make up for whatever loss you had in your DNB institute by taking up SRship in a more busier institute, in a center which has more OTs, and in a center which gives you a chance of increasing your skill set. Okay. Remember, life goes on. It's a very long process. ऐसा नहीं है that you will learn everything in 3 years of residency. नहीं. If you feel that you join an orthopedics residency and at the end of 3 years you will be able to do your total knee replacements and total hip replacements, बिल्कुल भी ऐसा नहीं होगा. It takes you at least a minimum of 6 to 7 years since you join your residency to settle into any branch. तो वो दिमाग में लेके बैठो तुम लोग कि क्या करना है आगे जाके. Okay. Now there are many branches which many of you all even don't consider, like pharmacology, and you have microbiology, which are thriving so well right now. People have labs which are doing so well. You have people who have done MD pharmacology and gotten into pharmaceutical companies, and they have a nice 9 to 5 job with no emergencies, and they are earning very well, and also they are heading pharmaceutical companies because they have an MBBS background. So all that, many of us don't consider non-clinical branches at all. So also find out about those non-clinical branches from friends you may know in those branches. I will also be taking a session on that on Friday, clinical versus non-clinical branches, and you can listen to that and also make up your mind. Increase the number of available options for you guys, and that is how you will realize whether you want to take up a seat in this NEET PG or not. Okay. Now the next thing is talk to seniors in the course. So if you've decided you want to take medicine or anesthesia, as I already told you before over here, you should be speaking to the people who are already doing the branch, and you should be asking them about the opportunities in the branch. You should be asking them about how residency is in the branch. You should be asking them about the study post residency in the branch. How many more years will you require to settle? Will you need to give a super specialty exam or not? What are the options abroad in that branch? This is a very important thing, because many of you want to go abroad and then you end up taking branches like surgery. In surgery, it's very difficult to get into any of the countries abroad, because they don't give surgical branches very easily. On the other hand, if you have set in your mind that I want to go to the US or I want to go to the UK, then try to go for branches where you can get a seat easily in the US or the UK and become a consultant there. Try for branches like psychiatry, try for branches like anesthesiology, in which you know that you can easily get a seat abroad. Okay, don't go for surgery, ENT, opthal, all these branches where you will not get a seat abroad, because then you will have to give up that dream. Okay, alright. Now next is, if you will definitely not make it this year, then what are your options? So first of all, I gave you all an idea of, if you are in that grey zone, you don't know whether you're going to get in, whether you're not going to get in, whether you should wait for another year for the dream seat that you have in mind, or whether you should go ahead with it. Okay, so if now all that is sorted, you have made up your mind ki nahi, I want to do only orthopedics, and since this year I am not getting orthopedics, I am going to repeat the NEET PG exam. So then how do you go ahead with it? Okay, so before that I am going to take a few questions from you guys. So S Singh is saying, ma'am, is MD degree less than DNB medicine in getting job, respect and other things? Trust me, for any kind of job, if you are trying in a government medical college for a job, they might give slightly more preference to an MD student as compared to a DNB student. But again, at the end of the day, there are more important factors, like, are you having more experience than someone who has an MD? Are you having more academic achievements, publications, conference presentations? Are you having, how is the way you work? That is also very important, which they take into account all of these things before taking you up as a consultant. So it's not just your MD or DNB degree which makes a difference, but it's actually the whole package that comes along with you. If you're talking about a corporate hospital, they don't care whether you have an MD degree or a DNB degree. At the end of the day, they will only want that you have a good ranking outside and you can get enough patients to the hospital, and of course that you are a good surgeon, or you're good at your job and you're professional, you have enough patients who will vouch for you, you have good reviews, and you will make money for the hospital. Okay, so those are the main criteria for getting a job. And also the experience, the post MD experience matters a lot. If you have degrees from abroad, matters a lot. MD DNB is only in the beginning when you're taking up your NEET PG ranking to scare you guys. Baad mein no one will ask you about it at all. Okay, alright. Next, ma'am, can you suggest good DNB institutes in South India? So for anesthesia, one of the best DNB institutes that we have is Sri Ramchandra Hospital, and in Chennai, SRMC, and then you have Ganga Hospital in Coimbatore, and other than that you may be having a lot of other hospitals, but I'm not aware of it. But these two hospitals definitely are extremely good, personally recommended. Okay, what cardiomyopathy develops in Duchenne muscular dystrophy? Why is this question coming in the middle of will I qualify for NEET PG or not? Okay, Yash Star is asking, ma'am, how is life after MD pathology from Tata Hospital? Okay, MD pathology from Tata Hospital, first of all, pathology in Tata is extremely rigorous. You will have anywhere between 12 to 14-hour days, working days. So be prepared for a hectic residency. But after that, you can get into any of the upcoming cancer hospitals to train as an oncopathologist, and job opportunities are great because cancer is a very upcoming branch right now. Okay, and Tata Hospital being one of the best branches available, one of the best hospitals in Asia to train you for onco. You can easily get a job in onco anesthesia in any of the hospitals all over the country. So it's a great branch to go for. Alright, okay, so now the next thing that we need to discuss is, if you definitely do not make it this year, then what are your options? Okay, so one option is to join a job, and second option is to exclusively sit at home and study. Okay, so these are your two options: either join a job and try to study with the job, or you exclusively sit at home and study. Now, how do you decide between the two of them? There are 2-3 factors. One is your preparation. So many of you all must be doing your internship, and as a result of this must have not had time to prepare for NEET PG 2021 very well. So if you feel that you're highly lacking in your preparation and you require a long time to prepare, and you require some like concentrated efforts in preparing, then it's better to sit at home as compared to joining a job, because once you join a job you will also be working the entire day and you will get tired as a result of this. And it's better that you join a job, so it's better that you sit at home, complete your portion, give the exam your best shot, because you can always work at any point in time. Okay, now the second thing that you can take into account, if you have already studied, if you're giving the exam for the second time, or if you already completed your entire portion once, it's only revision that you have to do, and then in that case you can join a job. You can probably do your MBBS bond, and along with that you can make sure to study for the NEET PG exam. Second thing, what is your state of mind? Now this is extremely important to take into account. Many of you all are tired of studying, sitting at home, doing nothing, going to the library, coming back, and you all will be like, बस हो गया, अभी मुझे और नहीं करना है ये सब, ठीक है? So if you feel that sitting at home and studying is now something that you cannot do exclusively, then you can join a part-time job. Okay, so you can join a part-time job. Now in this part-time job you can try to join something which is like 4 to 6 hours of OPD, or something which is a work from home option. So as you know, for doctors you have many work from home options like Practo app, Liberate app. All of these apps, they employ MBBS doctors. Once you have your registration, state medical registration or MCI registration, you can register on the app and you can work from home, make some money for half of the day or how many ever hours you want to work, and then rest of the day spend in studying. Now with both the things, either if you're joining a job and studying, or if you're exclusively studying, remember you need to have a solid schedule. Okay, so if you do not make a schedule, if you just randomly go about your day, irrespective of whether you're studying for 10 hours a day, 20 hours a day or 2 hours a day, you are not going to clear the next NEET PG exam also. You have to make up the schedule from day one. Suppose you're working from 9 to 3, you know you are going to be, and it has to be a realistic schedule, you know you're going to be tired after working, so take a break from 3 to 5, and then you should be having a solid schedule for 5 to 11 PM every day of studying and completing your portion. Okay, so these are your two options. Either you start work, now in work either it can be private work or it can be bonded work. So if you have an MBBS bond, you can try to complete it at this time and kill two birds with a stone, or you sit at home and exclusively study. Alright, now next thing is, what are your exams to prepare for? So our main exam that we will prepare for is the next 2022 exam, and if you feel quite confident about your preparation, you can also give the INI CET 2022 exam. Okay, so this year, since the exams were delayed, you can expect the next 2022 to be anywhere in Feb March, and your INI CET to be anywhere in December Jan. Okay, so we will be making two different schedules for both of these exams. If you're sure that you're going to repeat, I would say start preparing for INI CET 2022 from now on. Okay, don't wait till the NEET PG results, don't wait till the end of September, don't wait for some random Monday to start. Just take 1 week of break post NEET PG. So maybe till next Saturday you can take a break, or sorry, not next, this coming Saturday you can take a break, that is on the 18th, and 19th you will, 19th of September, sit down, make a solid schedule for the next 6 months that you have till INI CET, and from 20th of September we will start studying again. Okay, now here it will not matter whether you feel that you're going to get a rank or no, whether you feel that I don't know what is going to happen, should I take up a seat or no, at least you know that you have started studying. So whatever happens, you will have not wasted those 10-15 extra days that eventually will matter a lot when you're giving the exams. Okay, so these are the next two exams that we will we will be focusing on. I will also be making a schedule for you guys for both INI CET and next 2022, and I will be sharing with you on YouTube only. Okay, now if S. Singh is asking, ma'am, if I don't get seat this year, I want to marry. My father and relatives are forcing me. I have lost my mom. I am 30-year-old girl. If I start PG from 31, 32 age, then conceive as at 35, is this thought right? Okay, so of course it is, first of all, to study after taking up a to study while preparing for your NEET PG and get married. Both these things are a little difficult to manage. If you feel that you will be able to manage preparation for NEET PG exam plus marriage, new marriage simultaneously, then go ahead and do both of them. But if you feel that you will be able to manage, you won't be able to study if you get married, then in that case take up a NEET PG seat. Think of the options that you have. What is it that you like out of the options? Working as well as having a married life is not that difficult to manage as compared to studying and having a married life. Okay, so studying well and having a good support system in a marriage is very, very important if you want to prepare seriously for the NEET PG exam. But working requires a little less commitment as compared to studying, so definitely you will be able to manage that with marriage. If you are asking me, I would take up a NEET PG seat. I would take up a seat this year, start my residency this year, also get married, and then plan my future. You don't need to wait till 35 to conceive, but after 3 years of residency, you can immediately start preparing for a child. Okay. सुशांत is saying, मैम क्वेश्चंस काफ़ी ठीक हुए बट रॉन्ग भी हो रहे हैं. अब व्हाट टू प्लान नाउ? INI CET, exactly what I am trying to address here in this session for you guys. So yes, if you feel that definitely मेरी दाल नहीं गलने वाली है ये टाइम, and I want to make sure that I get into a good college and into a seat of my choice, start studying for INI CET. You never know. You already have studied so much for NEET PG. Now you only need to build up on that. Now how do you need to build up on that? You need to do the previous year questions very well. You need to do your grand test very well. So all those usual things that we know about. We didn't have much experience at before the NEET PG exam, but now you have experience of NEET PG exam, you have experience of one INI CET, and definitely someone who is more experienced will be able to crack this exam better as compared to a newbie. Okay, so use this to your advantage. If you feel ki you are going to give it another attempt, go ahead and start preparing for INI CET 2022. And what is the date that we start studying from? We will start studying from 20th of September. Okay, I am giving you a break till 19th of September, and then on 19th we are going to make our schedule and start studying from 20th. Okay, now next question. Ma'am, should I study at home if I am repeating? If I am repeating, should I study at home or should I stay back in the medical college? Now if you are repeating many a times, you may have to leave your hostel room and you may have to go back home, or you may have to take a PG accommodation and go back home. So now this is dependent on you guys what to do. Many people are used to studying at home. They like the environment in which their food, their clothing, their comfort is taken care of. Okay, so if you feel that all these things are taking up too much of your time, then instead of staying in the hostel, go back home. Take advantage of the fact that you have a support system at home. You have your parents, you have your siblings, and you have someone to take care of all these daily things for you, and go back home and study. Okay, now there are many people who say that, ma'am, if I am repeating, I need people for discussions. I cannot just do discussion on the phone or on Zoom or on video call. Okay, then there are many people who say that, ma'am, I need to study in the library. I cannot study without a library. I cannot focus at home. I keep feeling hungry or keep feeling sleepy at home. So this is another reason for people who think of all this to stay back in medical college. Okay, and ma'am, I need competition to push me. So if you are that kind of a person who will study only when you see people studying around you, then you should stay back in your medical college and study. Of course, when you're planning all these things, you have to take into account many things. You also have to take into account that you will be spending money over here. Okay, so if you don't want to spend any money, it's better to go back home. But here you will be spending on accommodation, on food, maybe minimal amount of money, but you will still be spending. Okay, so remember all this. It totally depends on you that what you want in life. If you want comfort and if you want support of family while preparation, go home and prepare. If you need your friends for discussion, if you need library environment, if you need competition around you to push you, then stay back in your medical college and study. Okay, so Sushant is asking cutoff idea this time. I have already discussed that in the beginning of the class. You can watch that part later. Okay, now many people are asking, ma'am, NEET PG 2022, they are saying it is a next 2022. Okay, so it's going to be a completely clinical paper. Now even for this exam, everyone was predicting that there will be 200 questions and they are giving you 3.5 hours. So definitely they will put long questions, they will put clinical questions. Yes, they did put clinical questions, but it's not like the whole paper was made up of clinical questions. There was a healthy balance of clinical questions along with your image based questions and your one-liners. Okay? So remember, every paper will be like that. They cannot just switch to the USMLE pattern of having long questions in one go. ठीक है, ऐसा कभी भी नहीं होगा कि immediately they will start off with USMLE pattern वाले paper suddenly from 1 year. It will always be a mix between clinical questions, one-liners, images and numerical questions. So even for the 2022 next exam, your preparation will be absolutely the same. It's not going to change much. What will matter more is not the matter that you have, not the basic theory that you have, but what will matter more is how much you practice till the next exam. Okay, so the more you practice, the better you will become at solving paper, the lesser will be your silly mistakes, the higher will be your rank. Okay, okay. Next very important thing, when you are planning to repeat, this makes so much of a difference in your preparation. Many of you all must have not got enough time to give grand tests. Okay, so you all must have given only 2 to 3 grand tests before your NEET PG exam. So when you go for your NEET PG exam, your state of mind is complete disarray. You're nervous, you don't know how to manage the questions. You come across one question where you don't know कि क्या चल रहा है, you will be एकदम scared and you will say suddenly the next 5 questions also will appear like a blur to you. Now how do you get over those kind of situations? And it is only by giving grand tests. The more you give grand tests in a simulated environment. And what do you mean by a simulated environment? Simulated environment means an environment in which you sit with the laptop and you give the paper in 3.5 hours without taking any breaks, just like you are going to give the next NEET PG exam. If you give more and more grand tests in a simulated environment, you will get into the habit or into the practice of giving a paper mock test similar to NEET PG, and you will see how you build up your stamina, how you build up your mental capacity to think in times of stress. Okay, and this is one of the very important things which you all don't realize. Toppers, rankers actually make a lot of difference in their preparation by giving more grand tests and having many tactics to navigate through different parts in the question paper. Okay, so when the final exam comes, you know ऐसा हुआ तो मैं ऐसा कर सकती हूँ. If I get stuck on one question, I can go to the next, second or third question. If I get stuck in the first 10 questions, I can start the paper from behind, from the question number 200 and come back. Okay, so those are some of the strategies that you develop if you give more grand tests. And of course, by giving more grand tests, you will also come across important topics again and again. So that will also help you in designing a good effective revision plan for the next exam. Okay, then next question, if you're repeating, should I do the same notes or should I change them? Now this absolutely depends on how your NEET PG exam went. If you felt that you had read the topics, so for example, in anesthesia it was on malignant hypothermia, it was on EtCO2, it was on local anesthetic systemic toxicity. So if all these questions were there in your anesthesia theory notes, but you made mistake, either you didn't read well or you made silly mistakes, then you know that your notes are adequate, it's your preparation which is not adequate. Okay, so in that case you keep the same notes, you will not change your notes, you will not change your coaching classes, you will not try to get newer and newer books. What you will do is you will consolidate on your preparation. Okay, but if you feel कि out of 5 questions 3 questions का topic I had not even read, I am seeing them for the first time, what have they asked? So this you have to do as per subject wise analysis. Okay, not just anesthesia, you have to analyze the questions. The questions are all out there, 200 ka 200 questions, analyze it subject wise. Microbiology के 15 questions में से how many questions had I never read before, I had no idea about it. So if that forms a significant number, that means your theory preparation is inadequate, your notes are inadequate, you need to change your notes. Okay, and if you realize that your theory notes were adequate but your preparation, your revision, your way you solve the questions was not adequate, then in that case keep the same notes, don't keep running from one notes to another, one book to another, one online center to another. Just focus on the stuff that you have and keep revising it again and again. Okay, alright, then next is, should I join a coaching center? Now this is extremely dependent on how did you prepare the first time around for NEET PG. So if for the first time that you gave the NEET PG 2021, if you did complete self-study, okay, if you did complete self-study, then in that case what will you do? You will not join, you will think about it, and if you feel you need help this time, you didn't do well at all during the NEET PG exam, you can join a coaching center. Okay, joining a coaching center gives you very important things. Now it gives you all the important topics, they give you a bunch of tests to solve, and they also push you. Okay, this is very important, you need some kind of environment or competition around you to push you for the exam. So you should be paying attention to all these things. You will not get it when you are doing self study. In self study you will feel हाँ मुझे सब कुछ आता है, मैंने सब बुक से पढ़ लिया है और सब नोट से पढ़ लिया है, but you won't be able to evaluate yourself, and many concepts you will just mug it up, you won't understand. But when you join a coaching center, you will be able to focus on the important topics instead of reading everything from A to Z. You will be able to evaluate yourself giving tests, you can understand the concepts, and also you will get pushed by the ranking, by the grand test that happen in the coaching center. So definitely if you have not done a coaching center before, you can do it now, and the easiest coaching center that you can join is Unacademy, because it's online, there are live lectures, you can talk to the educator during the class. We have an option of you actually speaking to the educator in the middle of the class, and you can even watch the recorded sessions as per your own convenience. So whenever you want to watch them, you want to watch them live, you can watch live. If you want to watch it in real time, if you want to watch it in recorded sessions, you can watch it in recorded sessions, and you will also get PDF notes, and you don't need to go anywhere, you can directly just open up your app and see all the lectures. Okay, now other than that, another important thing, if you plan to repeat, you need someone to guide you. Okay, Now this guidance will not be just in the form of teachers, but this guidance should also be in the form of your seniors. Now many of you all say, ma'am, my senior told me to study like this and that's why I did like this, but I did not end up getting a good rank by how my senior taught me. So you need to know whose advice to focus on or not. So it may be your senior or it may be your peer, but make sure that they have got a good rank, a good strategy in NEET PG 2021. This is super duper important. You need to have reliable advice for the exam. You just cannot sit and listen to anyone and everyone who is ready to give you advice. Someone will say, I crack NEET PG exam in 1 month, you don't require much time, just read these notes and you will be done. But it won't work for each and every person. So in that case, you have to focus on which topper you are speaking to. You are repeating the exam, you are preparing again now. This is your chance to shine. So you have to make sure that you also get correct guidance for the exam. Okay. So when you are listening to toppers, see if their strategy sounds normal. Okay, it shouldn't be someone who's studying 16-18 hours a day, but someone who has consistently studied 10 to 12 hours a day, who had a schedule and plan for NEET PG, and who has consistently done well in the grand test also. Those kind of people will be able to give you a good advice on how to prepare for NEET PG. So make sure to have a good sound guidance when you're preparing for the exam again. Okay. This one super duper important. I keep telling people again and again, if you're reading again for the next exam, it's not that you have to read each and everything again in detail. Whenever you study, always when you're opening up a subject, first cover the important topics. All of you know what are the important topics. Your coaching teachers, your seniors, your peers must have told you what are the important topics. So first cover the important topics in detail and then go through the not so important topics. Okay, don't get fooled ki last time I did only IMP topics and that's why I didn't get a NEET PG rank. No, it's not like that. It also depends on how you have applied your knowledge on the important topics during the exam or not. Okay, so your preparation strategy may always, if you are restarting your studies now, whenever you restart whatever subject you start, first do all the important topics and then go to the not so important topics. Okay, alright, next, PYQ game. This becomes super duper important. Now many of you all must have not had time during preparation for NEET PG 2021 to solve previous year question papers. But now since you're preparing second time around, you have enough time to go through previous year question papers and actually sit and solve them. Okay, so when you solve these previous year question papers, make sure that you are going to do 2-3 things. One is note down the topics that are asked in these previous year question papers. So suppose I am doing a previous year question paper, I will note down all the topics that have been asked in them, and this I will do for last 5 years. So there will be many overlapping topics, so you will realize कि ये topics तो मुझे करने ही हैं. They are the hot topics, they are the high yield topics, so definitely ये तो मुझे करना ही है. ठीक है? So when you are doing your theory, you will be able to focus on those topics. Second thing is mark the important questions that you want to revise. So for example, you start doing INI-CET ka last 5 years PYQs. So mark the important questions and keep, so that as you approach the INI-CET exam, you can just go through the marked questions again. You don't have to resolve all the papers again. You can just go through the marked questions and complete your revision. Okay. Next is the last thing. Many of you all must be thinking, ma'am is giving us so much strategy, she's telling us so much about repeating, but is it actually worth it to repeat in the exam? So now remember, I have given you a very good idea throughout this session on, first of all, what do you consider as your dream seat, and मुझे यही branch चाहिए, if I don't get this branch I am going to repeat. Rethink that strategy, rethink that part. Are you actually focusing on what you want to do in life, or it is just a whim कि मुझे ये branch करना है, मुझे यही subject करना है. Okay, once you have decided and realized that you want to repeat the exam and give your branch another go, then you should be focusing on starting with a schedule, making sure you have a comfortable environment to study in, making sure you have good guidance throughout your preparation, making sure you're focusing on important topics and PYQs, making sure that you're giving grand tests again and again, and obviously at the end of the day increasing your rank in the grand test. Okay, now is it worth it to repeat for 1 year or not? Think about it. Whatever I've told you, take some time tonight and write down, chalk it down on a piece of paper and think for yourself, what do you want to do in life, and is it actually going to be worth it for you to repeat a year of NEET PG, or directly take up a seat now and go ahead with your residency. Okay, so only if you think it's worth it repeating, go ahead with it, or else take a seat this year. So I hope this was useful for you guys. If you would like me to take more such sessions in which we will be discussing about what you should be doing, you guys can also ask me questions. I will be happy to answer it. Please do message me on Telegram, and I shall see you next time. Till then, take care guys, and bye bye.